Hello, everyone. My name is Mia Reeves. I'm a CPA and I own an accounting business. We have over 400 clients. We're helping them with taxes and accounting. And today I'm sitting down with my favorite clients ever, Dr. Nguyen, Duong, and Lan. They own a family doctor practice in Dallas and several other businesses that they would love to tell you more about. So the purpose of today's meeting is to kind of just introduce you guys to them and learn more about their businesses, learning more about how we've helped them save more in taxes and grow their business, and also kind of open up an opportunity for you to, if you want to get healthcare, affordable healthcare, if you have a business and you want to afford it and want to provide healthcare for your employees, but you're not at the size that would qualify for health insurance, then they might be able to help you. So I'll get started by I guess letting Dr. Nguyen talk a little bit about yourself, your business, and we can go from there. I'll keep asking you questions.
Okay. Well, hi everyone. Thanks, Mia, for having us. Just a little bit about us. I think we have three different businesses, we have the DPC practice, which is more of a direct primary care, family medicine. And then we also have Magic Touch, which is our medical spa. And then we have Young that runs our pharmacy. That's kind of a one-stop shop. But kind of overall how I started is I am family medicine board certified, love medicine. I do a little bit of everything. Used to be in a fee-for-service practice where we, I had a lot of patients, like 5 minutes per patient, 30 patients in the waiting, per day. And I was just kind of milling. And I really couldn't take care of patients that well because I didn't have time to like go over all the details, especially for weight loss or hormone or anything that I didn't have time. And so I decided to change practice to something we call direct primary care, where it's a membership-based clinic only. So I limit my panel of patient to where I have time to spend with my patient. I spend an hour for their physical because I got to go to the detail of all the things that they have coming from, we always kind of pride about we're a clinic that we does everything. So it's not just a weight loss clinic alone or not a hormone clinic alone. Our goal as a DPC is we optimize our patient's health. We do everything we can to make our patient the best that they can be at their current status, whether it is somebody that's 18-year-old, somebody that's in their 40s, somebody who's in their 50s, somebody who's in their 80s, right? So that's kind of our goal, is how we optimize their health, whether it's through lifestyle change, through diet, through hormone balancing, through, body composition and all that. So that's kind of the gist of what we do. I started with family medicine, but then I love medicine so much. And then I got board certified in obesity medicine because weight is a big thing in Texas. So everybody needs some help with that. And then got into hormone therapy is because in patients that in postmenopause or in male that are older, when their hormones are off balance, they can't lose weight and they feel bad. So that's why we do that also. And then my patient lose so much weight and they feel good. Now they start have wrinkles on their face. So then I start doing aesthetics too. So that's kind of how we kind of all branch all of these things together. But my short
Wow.
or
No
long.
wonder why you guys are so successful and you're growing so fast. Is because you kind of answer a lot of the questions women have, or people have in general, but especially women. I don't know if you guys are targeting women, but I would want to use all those services. So,
We
so
do have a lot of men patients
oh, you
also,
do?
but yes, women, as we do definitely make a huge difference, especially if their hormones are off balance, is a big deal.
Got it. And you do consulting as well, so people don't have to be on site. They can get the membership from you guys, and they can be anywhere in the country, right?
Yeah, so just to kind of add on to what Dr. Nguyen said, we're all about redefining medical care. Like we're like an alternative to health insurance because we're membership based. And with our membership service, you can get access to everything we have to offer. So that includes 24/7 access. So if a patient's like traveling or after hours on the weekend, you just want to get a hold of a doctor, we come in where Dr. Nguyen's always available to answer patients' calls. We do the physicals, the urgent care stuff, the weight loss that she mentioned, hormones, and then we tie it with the in-house pharmacy that we feel, which is Synergy Scripts, to kind of provide like the healthcare benefit plan that a regular person or individual would want that they can't afford because it's just too costly or too much. And so our plan is about $80 on average for DPC Health and then $5 for Synergy Script. So it's quite a bit of a saving, but because you get that personal experience with us and having that doctor and pharmacist available for you, we're able to do it all.
That is so cool. I already have in mind some clients I could refer your way. This is amazing. Okay, so good to know. Thank you so much for letting us know in details about what you guys are doing. When we're doing the accounting and the taxes for you, we see the numbers, like, but like it's really cool to get into the real operation of your business and like the value that you provide to clients. So backtrack a little bit. I think we met a couple years ago. Do you remember how you got in touch with us?
Yeah, I think at the time we were just like Dr. One was using someone that was like she valued and loved, but he was retiring for her CPA stuff. And so I happened to meet with my mentor about every other month or something. And I just brought up like, hey, we're looking for a CPA. Do you know anyone? And his name is Bruce Rabin. He works for Tech Fort Worth. So I don't know if you're associated with him or at all, but he was like, hey, I found this company. I think you should give them a try. So yeah, I think I gave you a call. We did like a quick one-on-one phone call, and I was like, this is great. Let me present this to Dr. Lynn. And then we talked further, and it became history from there.
Yeah, it was a while ago. I remember I was on vacation or going to Florida. And we met I talked to you, Lan, at first, and then with Dr. Nguyen, I show you like a presentation, like pretty late too, because you guys
Yeah.
work late, you guys work hard. And
Yeah.
then I when you became our clients, I was so happy because I do see that you guys are having a great business model, like a great company in general. Just the growth
Yeah.
experiencing so far, it's amazing.
And the truth is, at the beginning, I was very skeptical. I was like, I saw these questions. It's like, I don't know. Do we do this? Do we do it? And I mean, the thing is, and Mia knows. And one of the things I like about Mia, you, is that you're very patient. Like, like as I'm a Vietnamese strong woman who's just like, oh, are you sure that's right? I don't know. Like, I'm very questionable. And then I think like, and through the times, I've always kind of like, oh, is this the right thing for us? Is it not? But I think like back to it is that you do truly deliver what you say. Like you're not just like, it wasn't just like a presentation. You can save this much money, it wasn't just what you were saying. It was like you really proved it over the years. And so I think this year really proved it for us. We stuck it out long enough, and it's like it really, really did prove that you are a true value to us, especially with our growing business. We're constantly growing, and you just constantly give us our money back. So I like that.
Well, thank you so much for your kind words. I knew that when you talked to me, I was like, I do feel like I'm like you, or we're kind of similar personality. We have similar personalities because if I spend money on something, I need to make sure it's worth it. Or
Yeah.
to get an ROI on investment. If not, then it's a sunk cost and an expense. But if you spend money on something that you get a return, then it's suddenly you can spend as much as you want, but as long as you get 3 to 5 times what you spend, and it's worth it. So that's my my takeaway from like so many years of working with business owners too. It's and you are just similar to a lot of business owners we work with, because in the beginning when you work with tax accountants or bookkeepers in the past, like really didn't really know much about the advisory, the planning side. And so when we work with you, we know that we could provide a lot of values. And I'm glad that we're able to prove that to you throughout the few years that we work together. But I also want to give you guys credit too, by staying true to your word, because everything we tell you, and sometimes it's not easy to understand, right? Sometimes it takes work, and then you have to do some research and you get back to us, but you always like do whatever it takes to implement it, or do whatever it takes to just make it better, like make a situation better. So I could really see that you guys have the will, because I could tell you tax strategies all day long, but some people might not want to do this strategy because it takes time and work, and it takes some investment too, right? But like you guys did everything we tell you to do. So I appreciate that.
Yeah, we make a good team. I think that's
Yes.
important.
Good team for sure. So what I'm curious about your growth. Like what do you think would be the number one factor to like that contribute to your success, your growth over the years?
I think for us is because we care about the patient. So we always kind of I always kind of think, what can I do to improve the quality of my patient care? And that's how business come together. So I mean, that's how we grow, is because I'm thinking, okay, what can I do to make the patient even better than that, give them access, right? So for example, like we started out with just primary care, and then we add in things that can make the value of the membership even more. And then we add in the pharmacy, because it's like, it's convenient for the patient. Like after they're sick, they want to wait in the pharmacy and wait for hours to, or, you know, like they're under the weather. They need to get their medicine, go home, lay in bed. And so it's kind of like the things that we added on to make more income, it's also aiding our patient. So it's actually aiding our patient. There in turn, returns make money. And so that's, for us, is like, the more we care, the more things we do for our patient, income starts to grow that way. It's not because like, oh, I'm out there, I'm going to do this so I can make more money off my patient. I'm doing this so I can help my patient. And then in return, I get a little back.
That's true. So always the client first, patient first mentality. Like the more you help people, then the more you get things back, right? I love that about your business. I do remember one thing that we talk about in one of our phone calls is that I was telling you, when we're a small business, let's just say we make under $1 million a year in revenue, we're smaller, and we had the mindset that we have to do everything ourselves. And it's harder to grow a team because we're just wearing multiple hats. But I've seen your growth, and I've seen that you have Lan to help you. She's your right-hand person. And then I'm doing to have the pharmacy, like you're branching out and you're knowing what kind of cost to cut, or where to put in new people, or how to hire new employees, right? You've grown a lot over the years, and we're the same. We're thinking the same way. We're talking to each other all the time. But what was like the point when you decide that, well, I cannot do it myself anymore, I have to hire someone, or I have to spend more in order to make more in return?
It's usually after our financial call from you, like, oh, you don't have to pay that much, or we got it, right? So the truth is, when we first started, like I took over DPC, I literally like did not get a paycheck for like a year. And we kind of look at all our financial, how can we make this work, right? So we cut back the cleaning person, you know, like from the old practice. So we had like somebody who was cleaning the office. Young was helping us clean the office once a week, and we were taking out our own trash. We were, you know, no IT. Young was doing it, so Young does a lot of the footwork of all that stuff. And then Lan did a lot of the footwork, and we had less employees, and we were doing it all ourselves a lot. And then once we start to grow, and then you kind of let us know, hey, this is where you're doing financially, you're doing better. So then we kind of start to feel better about that. It's like, okay, now we really need to spend our time more quality. Now that we've moved in a new building, we do hire somebody to clean our office once a week instead of, you know, our team doing it, because we have so many other things that we can do to improve our practice.
Got it. It's like a shift in mindset to not do it all by yourself, because Angduan can spend more time on the pharmacy, which really in return helps the medical clients, right? And Lan can spend more time, and I've seen like doing operation and doing more of a CFO role for your business, and not doing just stuck in one place. Like your employees have the career path to see where they can grow. That's amazing. And then, Anh Dương, you have a pharmacy, right? So could you tell the audience a little bit more about that? So is the pharmacy connected with the main practice, or do people have to go through the main practice to join the pharmacy, or how did that work?
So our pharmacy is basically like any other independent retail pharmacy. So patients don't have to go through DPC to use this pharmacy. You know, other providers, they just have to have a prescription, and they send it over here, and I just fill it like any other pharmacy, like if you were going to Walgreens. Yeah. So yeah, very straightforward.
Same as any other pharmacy, but you also have
so pretty much like any other pharmacy. Yeah. So it's an open door, so anybody from outside can utilize this pharmacy.
Yeah,
That's
so
cool.
But they don't get that friendly face at the other Walgreens, or, you know.
Exactly. I was talking to customer service.
Yeah, the personalized. So he takes all insurance as well, and he's starting to compound. So he does more than just any retail pharmacy, but as a pharmacy as a whole, anyone could come and to get prescriptions filled through him, and supplements and over-the-counter things and whatnot.
That's cool. You know what is very interesting and very, very good about you guys is, even though you scale and grow your business a lot, and you've added team members to your business too, but the quality of service that you provide to your clients is still very good. Because one of the biggest struggles for business when businesses want to scale and grow is the bigger they become, the more chaotic the businesses will be, because you would have to train new people and manage people. And a lot of times, like when the owners do the work, like the quality is better than giving the work to someone else, right? But as in your business, you guys prove that you hire new staff, new team members, and people get the same level of care as when you do it by yourself. So that is really good about your business, and that shows in the financials as well. And of course, I see that you guys are still very busy. Like every time we have a call, it has to be like after 5 or 5:30, or sometimes it lasts until like 7. Because I know you guys have to work all day. So it doesn't kind of take away your main job of like being a doctor or helping patients or helping with a pharmacist. Like you guys still have to do a lot of work. But then to scale like that, and you have a team of people that can help you, that is amazing.
Yeah, we're very fortunate, and I always kind of tell the team, like the team is very good. They work hard, they come early, they stay late. It's because I mean and I think that having a good team is really important, right? Just like you having a good team to kind of help things, like everybody like being here, and we want to be with them, and so that's kind of one of the things I'm very prideful about our team is they like to be at work. They're all A's, they all want to show up, and that's what we're A team. Like everybody's an A team here. So I'm very proud of my team.
That's awesome. Do you find your team members how did you find Lan? Because I know that she is the one with you since the beginning, right? Since you started.
So Lan is my Sunday school student, like back in the olden days, when I was little. And when she went to college, and she's like, oh, I'm gonna get into something like business management or something. I was like, okay, sure. And then when I took over this thing, and I was like, and she kind of we ran into each other at somewhere at church or something, and she's like, oh yeah, I do business management now, and I was just put it behind my head. And then when I start to have to take this over, now I have to manage a practice. I thought, oh, I really need somebody to help me. And so I reach out to her. It's like, hey, are you doing anything? Can you help me? And so she came on to help me, and it's been an amazing thing. We're just kind of like a yin and yang. We're like sisters, even though she was my student back then. She called me like auntie in Vietnamese, like Cole, right? And so now we're like, and it's weird because then now I call her mom, like I used to call her G, like the older sister.
Yeah.
So it's kind of weird now when I see her mom, I don't even know what to call her, because now Lan is kind of like my sister. So anyway, but yeah, we're very close.
Yeah,
Wow.
we're like family for sure. It's like a family ran business.
Wow. How long was it? How long ago was it?
Oh,
You
when
guys
we met
met?
when I was 8, and I'm 29
Oh.
now, so that's been 20 years.
Oh, wow.
It's been a lifetime.
Wow. So you guys it's amazing to work with family or work with people that you think that you're family. And so it's just the way that I like to look at it in my team is we do feel like that too with our team members. Like Marisol, one of our team members, she started when I started out at the kitchen, and I was like, well, I don't have enough money to pay you, so how about I cook for you? And then now it's like we've grown to this, we have 12 employees. So we've added people to our team. Marlene, you guys know, she was with Patra, my other business partner, since the beginning. So we do feel like we're like a family too. But the nice thing about working as a team and a family is sometimes you would take on each other's slack, and you're like not very strict when it comes to like working together. But working as a team is different because you have the family love, but you still have the business mindset. And I've seen that in you guys, that you guys are super on top of things, good at doing things, but you still have that love for each other. And I mean, we think the same way about our business. It's pretty much the same. We run it like that. I tell my team, it's like, think about our company as like a Navy SEAL team. So we're so make sure everything you do is like, at the top, the excellence level. So I think we're nearly at the end of the podcast. And I want to ask you guys one last question. So if our audience or business owners want to get in touch with you and they want to use your service, maybe tell us a little bit about your pricing structure and, different tiers. I've looked at your website, but I want people to hear from you, and then how to get in touch with you.
I guess I'll take that on. I usually do our elevator pitch. So real quickly, like we've been saying, we're a membership-based clinic. So instead of dealing with like insurance, co-pays, premiums, deductibles, everyone pays that monthly membership fee and they get access to everything that we have to offer. So our services do include 24/7 access for a medical team and doctors. So all of our patients can contact us, especially after hours or on the weekends. We do very comprehensive physicals that include EKGs, a body composition analysis, a full body skin examination. For women, we do pap smears and breast exams. All your urgent care stuff will be taken care of. So think like casting, splinting, laceration repairs, joint injections. And then if you're interested, Dr. Nguyen is board certified in obesity and functional medicine. So weight loss and hormone replacement therapy is included as well. And all of that's $80 a month. And so it's a great alternative to insurance, and you can tackle it on with Synergy scripts for $5 a month for access to his in-house formulary for $5 for a 30-day supply on everything that's listed. And he has everything from cholesterol to ED meds to pain medicine to migraines, things of that nature. And so we work really with any individuals who don't have insurance, or maybe they have a high deductible insurance, or specifically small business owners who want to provide benefits for their employees but can't afford the health insurance plan. They can contribute as much or as little as they want to our plan. And we actually come on site to provide convenient employer visits. And so we have a mobile van that will drive with our mobile clinic. Dr. Nguyen and a nurse comes out, and we see patients on site so that they don't have to take time off work just to come see us for an appointment. It also closes the gap in like their healthcare needs, because like people don't prioritize their health, and so now we're bringing the health to them, and so it helps increase employee retention in that way as well. So we like to work with literally anyone who's interested in giving us a shot.
Wow, that's amazing. So $80 a month, and you pretty much have everything that you could think of. And then you also go to the site as well. And only in Dallas, right?
So we're Keller based, like our clinic is in Keller, but our van will go anywhere. So we have employer groups from Prosper and Granbury and Plano and Denton. And we have a telemedicine plan. So as long as anything is allowed through the states that, you know, patients are signing up in, Dr. Nguyen can do televisits with patients and really work with them. We are partnered with labs that we can send them out to anywhere they are at. So we work really hard to try to be able to be accessible to everybody.
That's amazing. And now I wish that I live in Dallas and have everybody else live in Dallas too. It's something the thing that you guys are doing, is that like common in your industry, or you guys are one of a kind? Like only you are providing these kind of services?
I think there DPC practices exist out there, so membership style practices. But I have to say, Dr. Nguyen does more than any other doctor out there, even DPC doctors. Like she has the time to spend with her patients. She'll like a first visit patient. It's about the 60 minutes because she's going to get to know them, talk to them, understand them, build that patient-doctor relationship. Something even like I Google all the time, like trigger point injections. Nobody here does that. No, unless you're like a certified ortho surgeon or something. But Dr. Nguyen does. Like she's gone out of her way to research and learn about it and provide that, so patients don't have to be referred around. And so other doctors don't really put as much attention and care because they don't have the time to. But Dr. Nguyen definitely goes above and beyond for her patients, and she talks about the optimal health all the time. She really wants her patients to be A+ patients too.
Oh, that's amazing. Well, that's why you guys work until 7 every day for a purpose, right? For a bigger purpose, to help people optimize their health.
Yeah.
But
yeah, I always kind of talk about like, you know, I don't want my patient to be in a wheelchair when they grow older. Don't want them to take a gazillion of pills. Want them to be like traveling the world, enjoying life in their 70s and 80s. Not like I'm so tired and I can't go, you know?
Wow. Well, that's amazing to hear. You guys do remind me of my parents and my sister, even though you guys are a lot younger. And so kudos to all the doctors out there. You guys are doing amazing.
Yeah.
But yeah, thank you for the interview. I think this concludes our interview for today.